Hello, hello, and welcome to our first therapy podcast. So this therapy section is going to be broken down into therapy part 1 and therapy part 2. And I know we're going to move through it a little bit quickly, so we'll spend more time in class applying it, but I'm just going to describe the different types of therapy that are used today. So, first of all, what are your options for therapy, right? You could go to a psychiatrist who prescribes medicine, a psychologist who usually has a PhD and is trained in diagnosis, a psychiatric nurse or a social worker would be in the hospital with treatment, and then you have a counselor. And a counselor does psychotherapy. A counselor is going to definitely have a master's, but they might have a master's in social work. They might have a master's in counseling. You know, it doesn't really matter. And they provide family, marriage, substance abuse counseling. Treatment, you have inpatient, which is where you go live at a hospital 24 hours, or outpatient, where you do appointment. So today, right, there's two types of therapy. There's psychotherapy, which is like an emotionally charged, connected interaction between a therapist and someone who's suffering from some sort of psychological difficulty. It doesn't have to be a disorder, right? But like I said, a lot of times they will diagnose with a disorder because insurances often require it. And then you have biomedical therapy, which is involving with drugs, electroconvulsive therapy, and in the past surgery. So we're going to focus on psychotherapy during part 1. All right. The basic types of psychotherapy is individual, and it focuses on the therapeutic relationship, client and therapist, and our relationship. Then there's group, and that's usually with 8 to 10 people, and it works on the relationship between group members, supporting each other, modeling each other, confronting each other, and they're all unrelated. And then you have family, and that's 2 or more individuals from the same family, and they really focus on the family as a system and what kind of patterns of behavior family members have, and what are the rules of the family, and how do those rules cause problems. Okay, so just like anything else in psychology, each of the perspectives, right, the hand has a different theory of the best way to do therapy. So psychoanalysis, that's your thumb, right, focusing on the past. That really, obviously Freud, right, and they thought that problems were caused by unconscious repressed urges. And the goal was for a client to gain insight into those repressed conflicts in order to solve them. The problem is that it's long-term and it's expensive. Okay, so what are some of the actual techniques that Freud or his followers would have used? The first and most important is free association. So this is the idea that the client would be allowed to verbalize any feelings or thoughts that came to mind. And sometimes, the therapist might give them a suggestion and then tell them to go from there. But it's the idea that they're associating freely with not blocking their unconscious or their id. When this is happening, there is a possibility that the patient might transfer some of their emotions linked to other relationships, like a parent specifically, because we know they're very important in psychoanalysis, onto the therapist. So instead of hating your parent, you maybe take it out on your therapist. That's called transference, when you transfer how you feel. Another thing that could happen during free association is resistance. And this is intentionally holding back information or sabotaging the therapy session in order to protect yourself from that, scary or bad or frightening idea or thought or image. Today, right, people who use psychoanalysis tend to call, it's moved from to psychodynamic. That's like the neo-Freudians, that's the new school of Freud, and it's more short-term, especially since most insurance companies won't pay for long-term anymore. And it focuses on the past, but it takes a look at how current issues are impacted by the past. So while Freud might focus solely on the past, they're more in the current and how the past relates to the current. And this is called interpersonal therapy because they want to gain insight into the roots of the difficulties, but focus less on undoing the roots and just knowing them and seeing how they impact the current. The next type of therapy is humanistic therapy, right? And this is our ring finger for love, right? And this client-centered therapy is Carl Rogers' main idea. And the cause of the problem, according to client-centered or humanistic therapy, is that people have been blocked from reaching their self-actualization and self-acceptance, right? And that's usually from lack of unconditional positive regard or any number of other things. And the goal of this therapy is to enable growth of the client in order to reach their full potential. This type of therapy is really client-centered, and that they believe the client should direct what's going on, right? It's called, one of the techniques they actually use, it kind of sounds weird, not like a technique, but it is, it's called non-directive. So the client actually says what they want to talk about, and the therapist does not suggest or give ideas or comment on what they think is right or wrong in any way, shape, or form. which can sometimes be frustrating because they might ask, like, what do you think? And they won't answer that. One of the most important things that the therapist will do is give the client unconditional positive regard. So while they won't direct the session, they will accept the client for who they are. They will not judge them. They will actively listen to them, so they will restate and kind of clarify the thoughts and feelings of the client. It's amazing how much damage can be repaired through feeling like somebody is listening and hearing what you have to say. A lot of people feel ignored in our society. And the last thing a therapist will do is give you empathy. So they seek to have an emotional understanding of the client and show genuine empathy and caring towards, who you are as a person. All right. So this is Carl Rogers, and I just want to show you a picture of him and what he looks like talking with some other therapists. Behavior therapy, right, really focuses on, there's no big names you have to know here, really focuses on the cause of the problems being dysfunctional or negative behaviors learned through experience. That's why it's this finger, because you had to learn that this means the F-bomb, right? So that's the cause of the problems, dysfunctional or negative past experience. So what the goal is to relearn a positive behavior or get rid of the old ones through classical and operant. So we've already learned about classical and operant, so now you're just going to apply it to therapy. And this is very commonly used to treat phobias and anxiety disorders, especially OCD. So what are some techniques? One is systematic desensitization, right? And this is a type of exposure. Well, what they do is they use classical conditioning to associate a pleasant, relaxed state with something that causes anxiety. So they systematically desensitize you, the person, to whatever it is you fear. They show you a picture. They, make you draw a picture. They maybe put something in the room. They put it closer to you. They make you hold it, whatever. There's steps along the way. And each time your anxiety will go up and then it will come back down. And they can either do it in real life or in virtual reality. And the way that they teach the person's anxiety to come back down is through progressive relaxation, okay? There's a more intense form of this called flooding. And it's when they don't do it systematically but kind of all at once. Aversion therapy is the opposite of systematic. So instead of trying to increase a pleasant state, they try to increase the unpleasant state. So it's used to treat alcoholism, where they'll put something in the drink that when they drink it, it'll make them throw up, and then they'll associate drinking with vomiting. But that's not perfect, though, of course, because people have thought and they understand that when they go out to a bar, nothing is in their drink. So it's not a perfect technique. So this is a picture of what systematic desensitization would look like. And then aversion therapy. So you have drug cause nausea, alcohol plus drug nausea, alcohol nausea, right? Operant conditioning, one of the main ones is a token economy. And this is really where you reward someone for a desired behavior. So a patient in or a client in a hospital might get tokens or treats for behaving appropriately. They use this with anorexia or other eating disorders. If they eat their dinner, if they gain weight, they're allowed privileges. They're allowed to go watch TV or go outside or whatever. Same thing for other types of disorders in a hospital. They also try modeling a lot of times. So a therapist might model the appropriate behavior. The client watches the therapist, and they teach them social skills and assertiveness, and able to better have them interact and use I statements. I think, I believe, that kind of stuff. Cognitive therapy, is this finger right here. So it's all about the thoughts. And Ellis and Beck are the two names that you should know, Albert Ellis and Aaron Beck. They think that problems are caused by negative thinking patterns. And their goal is to teach you new thinking patterns, right? Which then hopefully will affect the way you act. So thinking and then goes to the action. It's commonly used to treat depression. And it's often combined with behavioral. So a lot of times both. They try to fix the thought and the behavior simultaneously. So here's how cognitive therapy works, right? You have a situation. You lost your job. Now, someone who would go about thinking about this as internally is like, I'm worthless, it's hopeless, and then depression. But if someone could externalize it and change their thought, they could think, my boss is a jerk, I deserve something better, no depression. So that the illness is caused by the faulty belief. So one of the techniques that Beck specifically uses is he focuses on how humans can distort things, errors in logic. So they tend to catastrophize, all or nothing, or personalization. It's all going to be over. If I don't do this, I'll die, that kind of thing. And he wants to identify those errors in logic and then test them in order to show the client that their errors, that the errors are wrong, right? That their thinking is incorrect. And there's often homework outside of the therapy session. And here's some example of the cognitive distortions. You can take a minute and kind of read through some of those. Another cognitive technique is by Ellis, and this is rational emotive therapy. And he focuses on the ABC method. So same idea as VAC, but a little different method. He says A is the activating event, losing your job. B is the belief, I'm worthless. And C is the consequence, depression. So he tries to change the belief in order to change the consequence. Right? Lost my job, I'm worthless. Sadness, hopeless, anxiety. He's going to say, have people ever lost their jobs before and found new ones? Does this make, does being fired make you worthless? Aren't you good at other things? So he tries to debunk or get rid of the faulty beliefs. And then hopefully you can, create a new emotional state. All right? So that's all for now, AP Psychos. And remember, psychology is flippin' awesome.